Good day, everyone. This is MediaSmartGuy TV giving you information and insights on health, medicine, nursing, law, entertainment, do-it-yourself projects, DIY. Here are some tips and all about what's hot and trending topic today. So now let's start. Trending topic today is India hits new world record for COVID-19 infections. So let's try to check the reports and news from different outlets, media outlets like CBS News Live, Channel 4 News, BBC, CNN, and other reputable news organizations. Let's check this out.
India has set another global coronavirus record with more than 380,000 new infections in just the past day. That brings the nation to more than 18.7 confirmed cases, a jump of more than 1 million people in less than a week. More than 208,000 people have died.
If you can see, it says coronavirus in India. There are 386,452 new infections, and the confirmed cases are 18.7 million. And in fact, in just less than 1 week, it was 17 million. So that's around roughly more than 1 million cases or confirmed cases in just less than 1 week. Imagine more than 1 million. How many people are affected in just less than 1 week? Now the deaths are already 208,000. So 280,000 deaths. 208,000 people died due to coronavirus in India. That's a massive number. So let's continue.
A jump of more than 1 million people in less than a week. More than 208,000 people have died since the pandemic began. Much needed medical supplies are arriving in India from around the world. Overwhelmed hospitals are in dire need of oxygen concentrators, COVID tests, and masks. After a pause, vaccinations are set to resume Saturday. But despite India being one of the world's largest vaccine manufacturers,
Okay, so in India today there is a great lack of oxygen, masks, ventilators, hospital equipments, PPAs, everything needed for the survival of people with COVID-19 infections. And in fact, according to the news, and it's I think popularly known that India is considered as the largest vaccine manufacturer in the world. But as what the news said, it says that today India is in short of doses. They have lacking in vaccines because there are millions who are getting infected every week and thousands in every day. So that's quite an irony. You're the largest vaccine manufacturer in the world, and yet you don't have vaccines anymore to give to your people. So let's proceed.
the country is short on doses. And as the death toll rises, families are forced to wait in lines at makeshift crematoriums.
Check. What is the situation inside the hospitals in India?
Skirts, the patients are gasping for oxygen. 100 more are waiting outside despite being told.
So inside the hospitals, they're already filled up with patients who are all needing oxygen in order for them to survive, in order for them to breathe. While there are hundreds also COVID-19 patients who are waiting outside the hospital just for their chance to being treated or to come inside the hospital for treatment for COVID-19.
There's not enough gas gas or beds. Their best hope is that if somebody here dies, then that will free up a place.
So pathetic. Waiting outside in the hospital, there are lack of oxygen, lack of medications, lack of PPEs, and their best hope, take note, best hope of these COVID-19 patients who are waiting in line outside the hospital is that if somebody dies, then they will have a free space, or they will have the opportunity to be treated inside the hospital. Such a pathetic case wherein you mean you have to wish that somebody dies in order for you to be treated with your infection inside the hospital. If nobody dies, then you cannot be treated. And such a very desperate situation in India right now. So some are just waiting in line outside the hospital, some are waiting inside their cars, and most of them are gasping for air, cannot breathe. They are in the state of dying.
हमारे पास जो सप्लाई है मेडिसिन का, जो भी ऑक्सीजन का सप्लाई है, बेड ऑक्यूपेंसी है, वो डे बाय डे कम होती जा रही है। तो इंडिया में सिचुएशन इस टाइम पे बहुत बुरी है। क्या पता इन फ्यूचर और भी ज़्यादा बैड होती जाए ये सिचुएशन, मतलब बहुत ज़्यादा इट इज़ गोइंग फ्रॉम बैड टू वर्स ओनली।
That's what the nurse said. The situation in India is from bad getting to worst. Of course, you can see, even us who are living outside India, could very well see in this videos and documentaries and news that it's really getting worse each day.
Relatives of those queuing for treatment are trying to stop them from dying in the street.
My father is in a very critical condition. I'm getting no help. Numbers are given there, but nobody is responding. Numbers are not reachable.
It's really disheartening and so frustrating to hear that most of the people there have the same experience as this lady, wherein their relatives or family members are having COVID-19 infections and they are asking for help, but nobody is responding. Why? It's not that the health workers would not respond, but they are already infused with several clients and they don't have already the manpower or resources to respond. The healthcare system in India is really overwhelmed with the massive demands for healthcare.
This man's family say they took him to hospital, but the doctors told them they had run out of oxygen and he should be removed. So now...
See, this case, his relative, or is that his father, is already in the hospital, or is already a patient in the hospital. However, the hospital said that there is already no available oxygen and they have to remove their relative or father from the hospital. And what they did is they have no choice. They have to bring the patient and just lay there in the street.
World's biggest vaccine producer when the vaccine rollout has come so disastrous.
So again, according to the news, India is one of the world's largest vaccine producer. But according to what the reporter said, the problem is that the vaccine rollout has come disastrously late. Meaning they have the resources, however, it's the time element. The rollout of the vaccines has been very late. There has already been several massive infections, plus the new virus variant in India, that is a super spreader variant of COVID-19. Okay, so really time is gold and should have been priority vaccination. So People, if you are not yet vaccinated, please get vaccinated so that we will help in stopping this COVID-19.
Dangerously late. Astonishingly, the Hindu festival of Kumbh Mela was allowed to continue along the...
What? There is already a very gross and worse situation of COVID-19 in India. However, the government, or shall we say, the authorities in India has lifted their quarantine restrictions and gave approval for the handling of the Hindu festival Kumbh Mela, wherein many people will gather and do meetups and meetings and activities in the river Ganges. And of course, what happens? This is a super spreader event. Are they not worried about what's happening in India, and they have to add more injury, or shall we say add more problems? Because this is already one major activity that will increase their COVID-19 infections. This should have been stopped, at least for now, that their COVID infections are very high.
River Ganges today, a super spreading event in a country where the official tally of 320,000 new COVID cases takes no account of the lack of testing.
This is my take on this video. Indeed, India hits a new world record for new single-day cases of COVID-19 infections. And the problem is there is lack of probable foresight or insight that there should have been measures, and I believe that India had some good measures because they I believe they have controlled the infections of COVID, the spread of infections in the early onset of this pandemic, but they have tried to lift or minimize their quarantine restrictions. It's too soon, guys. COVID-19 is still here. So as long as COVID-19 is not yet totally eradicated, we should still maintain those restrictions and guidelines in order to help prevent the spread of COVID-19. So there is a mismanagement or lack of foresight of the authorities of India, and also the people. There could have been just a lack of insight into the gravity or the seriousness of the event. They have even to have hold their event like the religious event, although we believe that is also important, but at this time they should have made some guidelines into preventing the spread of the COVID-19 infections. So that's it for now, guys, and I just wish that India will recover from this global pandemic and this very desperate situation. And I hope the other countries will try to help, because India is part of our global community. Whatever happens in India would ultimately affect us all people of the world. We are one, and therefore we should help one another. That's it, guys. This is for MediaSmartGuy TV, and have a nice day.